And
Oh,
we're glad that you're joining us again today for a COVID update. Today's meeting, I think, is going to be a pretty important one because we're going to provide some updates on the latest data of what's happening both statewide and in Broomfield. Some of the modeling data, which again, we know what the modeling data, it's you can't always predict the future, but what the future could potentially look like. Where we're at with vaccinations and the big announcement from the governor today of opening it up to 16 plus. And then finally, some key decision points that we'll have to consider moving forward, given some of the public health orders. So as always, I'm Jason Volling, Director of Public Health. Deb Fetterspiel, our Deputy Director, is joining me, and Sarah Mock, our Director of Planning and Communications. So as you can see, the changes we've had from last week, we're continuing to see this 7-day change of cases around the 80 grouping. Unfortunately, we did have 2 hospitalizations, but thankfully no deaths, and our 1-week positivity went up slightly. Next slide. So as far as where we're at on the current dial framework, our 1-week cumulative incidence has been hanging around this 118.7. So we're fluctuating a little bit up and down in that 109 to 130, depending on the day. But again, our percent positivity is staying below that 5%, which is the important figure. And then again, you could see that we've had 11 days of declining or stable hospitalizations. Next slide. So as far as what's going on right now, and some of this is based on the modeling data. One of the key findings is Colorado is at an uncertain point. When they ran the modeling data, the hospitalizations had increased that week. And it was uncertain if it was due to chance, policy, behavior, or variance. But if growth continues, both in hospitalizations, it's most likely due to increased transmission. As you can see, about 23% of Coloradans are currently immune due to the vaccination or if they were previously infected. Some good news is it's estimated that 69% of the Colorado population will be vaccinated by May 21st. And I would just ask you to keep that specific bullet in your mind as we move down and talk about some of where we're heading as a city and county as statewide orders begin to devolve back to locals. And then maintaining transmission control at the current level for 4 weeks will avoid a substantial burden on infections, deaths, especially as variants continue to spread. In Broomfield specifically, hospitalizations in Colorado, the metro region, are declining among the 70 plus. So this is showing that the vaccine is starting to have an impact. And as I mentioned before, we're in level yellow, but we're seeing that there's starting to be a plateau in our incidence, which is good. Next slide. So this just further illustrates what I was saying about waiting the 4 weeks. So what you can see from this slide is if this assumes that there's no further spread of the B11 variant, and it takes into account what we're currently doing with vaccinations. So if we reduced transmission control to 70, 60, or 40% on March 19th, what we would see is probably a significant increase in hospitalizations if we went down to 40% transmission control. I think what you could see, the better news is hospitalizations won't be as dramatic as what has been predicted in the past if we stay within 60, 70, or our current trajectory of 79% transmission control. And this just further illustrates what I was talking about before of if we can maintain where we're going with transmission control for at least 4 weeks, what you'll see is there's going to be a significant reduction in deaths. And specifically, if you look at if we switch to 70% transmission control and we continue to see growth of the variants of concern by waiting from right now from switching to 70% transmission control to 4 weeks, you go from 797 to 390. And I think we all want to avoid the 40% transmission control occurring within that 4-week time frame. And then you can see the same projections without the growth of the variants. Next slide. And so another key point is that, as I mentioned before, the School of Public Health is running scenarios of if we continue along the same trajectory of vaccinating our population and assuming that 90% vaccine uptake in people age 65 plus and 80% uptake in all people under 65, what you see is that by May 21st, we reach a maximum of 69% of our population vaccinated. Again, that's extremely good news to see from the modeling data. There's a lot of assumptions here that assumes that we're going to see that same level of uptake, seeing the same level of supply. But if that does occur, we're looking at mid-May to start to see the vast majority of our population vaccinated. Next slide. And then today, the governor announced, based on some of the additional supply and where we're at as far as vaccinating our 70 plus and 60 plus populations, that as of Friday, April 2nd, the general public will now be eligible for vaccines. And so obviously we know we have a lot of our existing work in the queue as far as those that are signed up. But my understanding is we're getting to a point with supply and just the level of vaccine uptake that it makes sense for us to transition to the general population, and hopefully we see that same level of vaccine uptake. And the next slide. And I'm going to turn it over to Deb just briefly to talk about what we've been doing in Broomfield with vaccinations.
Sure, thanks, Jason. So just quickly there, you can see on this slide, we continue to make strong progress with vaccinating our population here in Broomfield. So we are continue to be pleased with our progress to date. As Jason mentioned, we expect there to be continued demand with the full population becoming eligible on Friday. The current group that we are focused on is pretty significant, and so we are experiencing I think there's definitely a lot of pressure on the system at this point, not only with first doses, but also having to account for building in second dose clinics with all the individuals that have been through their first doses. But the good news is, as both locally and around the state, we transition to these larger scale vaccine events that are possible because the supply is starting to pick up. We expect that pent-up demand to start to level out in the next few weeks, hopefully, as we make our way through April. And so on that note, we are continuing to push out vaccine and make available to our residents through a couple of different channels. Again, with that transition to the large scale vaccine events, we're continuing our partnership with Thornton Fire. We have drive-through sites online again this week, and we've been doing that for several weeks. And then this week we will operate our first large-scale event at the First Bank Center. That will be tomorrow, Tuesday the 30th. We plan to administer just under 1,100 doses. That will be an appointment, not a drive-through. And we're really looking forward to that also becoming a weekly offering for our residents, assuming we continue to get sufficient supply. So that will be the primary way, not just for Broomfield, but for counties around the state to focus on these large scale events so we can get as many people vaccinated as possible. The pharmacies are operating at maximum capacity, and so this will be another channel to be able to get individuals vaccinated. At the same time, we are still continuing our focus, as we have been since the beginning, on focusing on making sure that we're filling gaps, that we are reaching out through our community partners. They've just been essential through all of this to make sure that individuals who are eligible and would like the vaccine are supported in accessing those appointments. And so we continue to work really closely with those community partners to help facilitate access to these larger events, eliminate transportation and other barriers that may make it difficult, supporting people with how to sign up for these opportunities, and then facilitating access through our pharmacy partners. So we'll keep doing that. And once the 1-dose vaccine becomes available, we'll also be utilizing that as an option to reach some of our harder to reach members of our community. So lots going on, but I'm really pleased with the progress to date. So we can go to the next slide.
Yeah, and Deb, I could take this one. So I think what we wanted to do was walk you through what the latest data is and what we're projecting. And based on that, also sharing some of what's happening statewide and potential implications for us as a city and county. So one key decision point that we'll have as a city and county is what to do with face coverings. So the state order expires on April 4th. We are hearing that they are most likely going to issue another statewide order. And an option we have is, if they do issue that after April 4th and it goes through May 4th, we could follow that locally. The one caveat with that one is we hear it may be applied to limited groups and indoor settings. So one thing that's been talked about is any settings with individuals with more than 10 people, you would be required to wear face coverings, but not less than 10. And we'd have to see what that looks like in a public health order, how they'd actually specifically define that. Another option that we have is we could issue a local public health order on face coverings, or we can look at aligning with some of the regional face covering orders. And there's been a lot of discussion around masks and risk of transmission. And at the regional level, there's general agreement to focus, if there are orders in some of the other counties, which most of them will most likely will issue, to focus on indoor versus outdoor settings due to less likelihood of transmission in an outdoor setting. The other thing that's happening at the state level is the Dial 3.0 will expire on April 16th. So one option we have is we could continue to follow the state process. So what that means is, once the dial is dissolved, CDPHE may issue indoor event restrictions through May 15th. And what we're hearing is this would still include the 6 feet of social distancing, and also include that in those events of up to 500 people. If you go above 500 people, obviously they would want to look at that. The second thing is there may be a possibility that after May 15th, there's no statewide order with the dial, and the dial either becomes guidance or just completely goes away. We've been hearing it'll become guidance. So then again, the discussion for us is, do we want to continue to follow the state process of just using the potential updated public health order that goes through May 15th and reassess, or do we want to look at issuing a local order or potentially aligning with some of the regional counties around a public health order? And some of the discussions in full transparency that have been taking place is taking more of a step down approach regionally. And so what that means is after April 16th, if most of the counties in the metro region, and we're all at a similar place with our case rates, if we don't see a dramatic increase, that we would move to level blue. And we would stay in that level blue for a certain period of time, most likely 30 days. And then at that point, look at our data and do a reassess if we would want to continue a step down to level green on the dial, or if we would just want to go to fully reopening. So again, these are all options that we have as a Board of Health and as a City Council. And we'll go to the final slide. So that ends the presentation, and we can open it up for questions. And Deb, did I address the potential capacity limit in the modified dial order correctly, or do you want to clarify what that may look like after April 16th?
Yeah, I think, you know, we're in a situation where we haven't seen any draft language, so we're just, you know, basing information off of what we believe to be the case that the state is planning. But yeah, 50% capacity up to 500 people with 6-foot distancing for unseated events is what we are hearing would likely be the scenario that would be part of any statewide orders that are in effect from April 16th through May 15th. We haven't obviously seen a draft order, but that's what we expect to be the crux of it.
So Mayor, I saw you had a comment, and I don't know if you have questions as well.
Well, I mean, I'm not sure it's relevant at this point in time, but going from 80 to 70 to 40%, what does that mean? If you go down to 40%, does that mean that you're still doing social distancing but no mask? Or, obviously, this whole deal is based on certain assumptions. So I'm just curious on what it meant between the different levels. Not that I think it's all that important. I was just curious.
Yeah, so it takes into account masking, takes into account mobility and some of the social distancing and policy, and then behavior. And so when you look at those 4 things, they're able to sort of estimate where transmission control is heading. And they use the current hospitalizations as sort of the metric to say, here's where we're at as far as transmission control, and it could be all of those together. They can't specifically say it's one or the other.
Okay. And then, as long as I'm asking you questions, what is staff recommending? Once again, to a certain extent, we're kind of waiting to see what the state's going to do. But obviously, I would think that council would want to know, do you guys have preferences as what you think council should do?
Yeah, we do, Mayor, and I might wait to get the additional questions answered, if that makes sense, and then
I jumped to the chase. So I'll leave. So absolutely, have other people ask their questions.
Okay. Mayor Pro Tem?
Thank you, Jason. Well, I guess, yeah, with only half of us really on this call, it would be hard to get a true direction from all of council. I should add, it would probably need to be done when we're all convened, April 6th.
Yep.
But my question, the very high risk category from the New York Times, where are they getting that from? Because yellow isn't very high risk. So can you help me explain to people who are asking me about the New York Times?
Yeah. So what's interesting is with all of these dashboards, they're defining what the level of risk is based on community transmission using somewhat different metrics. And so the challenge is you'll have the New York Times that says you're in a high risk situation based on community transmission based on their metrics. And then what we know CDPHE did when they revised the dial was expanded sort of the case counts in that 1 week case incidence. And so that's where you're seeing some of those differences that are occurring between the national data sources and databases versus our
Local and state.
Colorado one. Yeah.
Okay,
Yeah.
that's a good answer. And then my only other question is more about vaccination and immunity. You said that there's a certain percentage of our population that are vaccinated and also immune because they've been infected and recovered. So if somebody does have the antibodies, how long do those last? How long does that immunity last? And should they get the vaccine anyway?
Yeah, so I want to make sure I get it. It's assumed that immunity due to infection wanes after 6 months if asymptomatic and 12 months if you're symptomatic.
So if someone's recovered, can they still contract COVID a second time?
There's been some cases of reinfection, but again, they've been more the exception versus the rule. I'd have to go back and look at what the specific number is around the percent of the population that's been reinfected. And again,
is it rare?
Yeah, it's rare.
Oh, okay. And then lastly, so are they contagious at all to others? Can they still carry the virus and spread it?
So that's the sort of data that we're still trying to figure out, both with the vaccine and with those that were previously infected. And so that's why Dr. Fauci and the NIH announced they're doing a study with college students. And the recommendation they've been providing is that people still need to wear masks out in the public after they're vaccinated, because none of the research they did when they looked at the vaccine studies were looking specifically at asymptomatic cases and the potential if you could still spread it. And so at this point, they're using the science to say, until we get that question answered, we're still recommending people wear face coverings. That being said, the CDC has issued guidance that if you're in a household with others or in a setting that are the other individuals are vaccinated, it's okay not to have your face covering on. So more information to come on that study to figure out what it means for the asymptomatic individuals.
Thank you so much. So for now, just use caution, right?
Yes. Yeah. Thanks, Mayor Pro Tem.
Thank you.
Councilmember Anderson.
Thank you. I had a similar question to our Mayor Pro Tem, and you noted it had to do with if you've had COVID, would you need to get the immunization? And you noted that, I think you said that immunity wanes after 6 to 12 months for those who've had COVID based on whether you're asymptomatic was 6 months, symptomatic was 12 months. And so I guess I have two questions. How does that compare to somebody who has had both of their Moderna or Pfizer vaccinations compared to Johnson & Johnson compared to somebody who has had COVID? Is it similar protections, or the ultimate question is, would you recommend for someone who has had COVID, especially for somebody who's been asymptomatic, should they also get should they still get the vaccination? I think that's the ultimate question.
Yeah. And it's a good question. So as far as if you receive the vaccine, how long immunity lasts, they're still trying to determine that. There's been some estimates out there that it could potentially last that full year. So sort of similar to it may be longer if if you contracted COVID and, that you have that immunity built up. But what they have found with individuals is if you had previously had COVID and you do get the vaccine, you see an immediate boost in your immunity. So there still is an advantage of getting the vaccine, even if you had a previous infection.
Okay, thank you. That's helpful. And then as you were discussing, I'm sorry, I jumped on this call late, so I didn't hear the whole presentation, but in the end here, you were discussing the mask mandate, and something that has gone through my mind, I just want to put that out there for others, is that depending upon your age and the category that you fall into, not everybody has been vaccinated. So it almost feels like it would be, until everybody's had that opportunity to get a vaccination, that wants to get a vaccination, it almost seems like that would be the period of time that we'd want the masks in place. That was just my initial thinking. And then also, and this isn't really a question, it's kind of a question, but if some of the stores or employers wanted to keep their mask mandate in place, regardless of what we did, they could still, King Soopers or some of the stores or Costco or whoever, they could still keep their mask mandate in place regardless of what we chose, right?
That's correct. Yeah. As private companies, they can determine what they would still want to do.
Thank you. And that's all the questions I have. Thank you.
All right. Thanks. Councilmember Lim.
With the possibility that that there were people who were traveling over spring break, when do we expect to see the question answered? Did travelers over spring break impact our COVID numbers in Broomfield?
Yeah, so typically it takes about 2 weeks for us to start to see that happen, because you have to go through sort of that incubation period and then have people get tested and get the results back. So about 2 weeks from now, we'll have a good idea.
Okay, and I would say, given the people possibly were traveling and they might have been traveling to states that have less restrictions than Colorado, that we really need to see those numbers in 2 weeks to even start to talk about what we're going to do in Broomfield. I'll just put that out there. And I find this a little inconsistent here. So we have Governor Polis, I think about noon, 10:30ish or something. Governor Polis talking about loosening, well, he's going to open up the vaccine distribution, but we have this state policy that's moving towards letting it up to the local municipal governments to enforce the mandate in a few weeks, the mask mandate in a few weeks. But I think just about an hour later, President Biden was having a news conference, pleading basically with states to continue the mask mandates. And I think I understood the CDC director is going to be talking to the governors tomorrow. So this isn't adding up to me with the direction the state of Colorado is going with leaving this up to the local governments. Do you have any thoughts on that?
Yeah, the insights I've received, and again, it's hard to completely understand the governor's thought process and line of thinking. I know he is looking at the modeling data and using that as a guide of where we can potentially be. But I can tell you, as a Denver metro region, we've had the discussions of the importance of masks and face covering. So back to my point before, is even if we see that by mid-May, the vast majority of our population has access to the vaccines, we would want to still keep some of those protections in place until we get start to reach that level of herd immunity where we have our full population not only have access, but they've received the vaccines and they've also received, been fully vaccinated through either the first dose or the one dose with J&J or the 2 doses with Pfizer and then and Moderna, and then the 2 weeks it takes after that to build up the immunity.
Okay, that sounds good. A detailed question on the First Bank Center vaccination appointments tomorrow. There was a note on the community update that those appointments were full. Is that correct? And is how quickly, I was curious how quickly those 1,100 dose appointments filled up, just, to see what kind of demand there is.
Deb, you want to take that one?
Sure. There's pretty significant demand at this point. That was kind of what I was referencing earlier. The supply and the demand are a lot out of balance, just with all the eligible population at this point. So it was less than an hour that those appointment slots filled up. So it went pretty quickly. And then we have had similar experiences with the signups for the drive-through events that we're doing in partnership with Thornton Fire, generally in less than an hour at this point. When we first started, we had it took a few hours to fill some of those clinic appointments, but now that there's so many more people eligible, they're filling up within an hour.
So do you have a established pattern now? If we're going to have those First Bank events weekly, is there a certain day that they're opening up that the public should anticipate if they want, if there's a high demand to sign up at that time?
No, that's a really great question. So we have been trying to set the expectation that the Thornton events open on Mondays, and generally we've been trying to have those on Wednesdays and Thursdays. There's some logistical pieces depending upon the type of vaccine, how many doses, when we're receiving it from the state, and so forth. But we're trying to keep those dates to the middle to later part of the week. And then with First Bank Center, we are intending to have a weekly cadence, again, pending supply. Often, unfortunately, it's the weekend before when we finally get commitments from the state regarding our allocation. So it's hard to give too much notice, but our intention is to have a weekly cadence starting off on Tuesdays with the First Bank Center events. But we may need to move those because, as I shared earlier, we also have to account for second doses. So we are scheduling out the second doses. So in a couple of weeks, we'll switch over everyone that's getting their first dose tomorrow. We'll need to go back in 3 weeks, get their second dose. So we'll need to move the first dose appointments to a different day of the week. So generally, not Mondays, but trying to aim for Tuesdays, and we'll continue to have our website be the hub of information. And again, we're doing the best we can to give people a few days notice, but we're just not at a place yet where we can plan much more than a week or two out based on how the process is working.
Well, thank you for jumping through all those logistics. I'm glad everyone's getting an opportunity to be vaccinated easier. Thanks.
Mayor Quinn.
Why don't you go to Devin's question first?
Okay. Yeah, it's in the chat. Deb, you want to take that one too?
Yep, I'm sorry, I didn't see that. We are relying heavily on volunteers. We have had a great response from the community, and so we are directing individuals to go through the process with the Broomfield VOAD, Broomfield VOAD at I think it's a Gmail. I'll chat in the email address, but through the Broomfield VOAD. So thank you for asking that question. It's been a great partnership with all the volunteers in our community in order to be able to pull off events of this size and scale.
Okay, Mayor.
Yeah, so let me ask my questions that I posed this morning first. And then you guys, I think you kind of gave your indication that you'd like to go with the regional group, you know, that if the state doesn't have a mandate, then you'd like to, you know, the region group that, you know, kind of formed a year ago and put pressure on the governor to begin with. And is that what you're kind of saying?
Yeah, I think even if we go with the regional group or don't, my recommendation, Mayor, would be that we do a gradual step down approach just through May and move to level blue, just to make sure we don't have a significant increase in cases. And my feeling is once we get past May 21st and we start to see if the modeling holds true, that we're seeing this level of vaccines take place and we're not seeing high level community transmission. I think at that point it's a discussion of, do we want to open up fully, or do we want to keep it at level green, which has a few restrictions on it, but it's pretty much opening up. And so that would be my recommendation, is a step down approach of going to level blue on April 16th, seeing where our cases go over that period of time, and then doing a reassess to make that determination. And the second part of that, I guess I would recommend, is that we would continue a face covering order if we don't believe the states meets our needs. And it's hard to predict what the state modified order would look like, but I think that's been extremely successful, as we're still have people indoors, and it's going to be for shorter and shorter period of time. But if we could get our public just again another month through May, not saying we need to extend it for a significant period of time out, we could see what that does with community transmission, and then set it for like a 30-day period and reassess, and just on a month-to-month basis say, do we need to keep a local public health order in place for indoors, or is it time for us to move to just broader guidance?
Okay, so so then go back to questions I asked this morning, which the staging of the stuff that I think council and the council cares about, and then the community cares about. So let me just ask a specific question. If you have 10 people that are vaccinated, can they get together in an indoor space, under the rules?
Yes.
And so when should council consider? So then segueing immediately back into when could council consider starting to get back together? Jennifer talked a little bit about June 8th, and I guess for the part why, and June 8th is going to happen pretty quickly, but perhaps we could consider that sooner if everybody was vaccinated, and we had a way of substantiating that.
Yeah, and I think if we were able to get council vaccinated, and then again, just following some precautions for a small period of time, like if you don't have everybody fully vaccinated, still having the masks and the social distancing, I would feel comfortable, because you get a level of protection after your first dose.
And my understanding is that you've been, you've been helping with the council members, and that most of all council members have been, they have at least had their first dose.
I don't have the answer to that one.
Deb, do you or Helene may know that more? Well, and I'm just saying that. So the bottom line is that if they're getting their first dose now, it would still be a month. Now you start doing the math, and I guess that comes down to maybe Jennifer's math. Yeah. If they got their first dose last week, and I've seen people on Facebook, I think Lori may have been one of them, that so if they got it last week and they got Moderna, so it would be at least 6 weeks anyway. And that kind of takes you to June 8th.
It does. And the other piece was, so we're opening the building in June. And so it was just, again, it was that not only making sure that council had their vaccines, but that staff had their vaccines as well. Okay,
so Jennifer, I get your date now. And so from a mental point of view, council should start thinking that June 8th would be the soonest we should do it safely. And I see Jason. Okay, I walked through it myself, and I now understand the math. And then my other two questions, and maybe you can take Eileen's comment, next. But my other two questions were that given the May 21st on 82%, that we could we could seriously consider doing July 4th this year. And you know, I mean, I'm not knowing what variants or stuff could happen, but once again, you would be looking at that 82% for July 4th and the same type of math, and you know, and so that's, I mean, I presume you're starting to think about July 4th and you're starting to think about you know, Broomfield days.
So we've had those, we started those, Jason and I are laughing. So we've started having those conversations. And again, it's the following the same path that we've had about science ruling, and following the data with the public court of public opinion, that really look at the hospitalizations being minimal. And again, so I've had a lot of conversations when Jason talks about the regional approach, and the public health director is recommending one thing, and we've all been very supportive of our public health directors, but you can see a split. Jason's saying, yep. From some of our city managers and from some of our county managers that are saying, once you begin, so the gradual opening, those days are almost over, right? I mean, so again, once the vaccines hit that 80%, everything else is just going to be so difficult. So Adams County, so Ray and I talked over the weekend, again, really wanting to do that regional approach. And their thought was, because originally we talked about June, and well, I'm not talking about 4th of July, but again, just the concept of expanding this through the end of June. And that was just, they were not on board with that. That was not something that they felt that they could extend. So again, that drives the conversations about the holidays. So when we start talking about the 4th of July, again, hospitalizations are minuscule. Vaccines are exponential. To think that we would be able to have crowd control. So when we talked about Broomfield days, right? Usually we have 15,000. I told Clay, we need a plan for 35,000.
Yeah.
40,000. For Broomfield days. And what does that look like to have events on Friday, Saturday, and Sunday? You know, expanding that. So I think the same conversation, Mayor, and Council extends to the 4th of July. To think that we're going to be able to manage a crowd on the 4th of July, we're not going to. I mean, again, that's just realistic, particularly with the restrictions that PD has right now with levels of engagement, and we don't want to set them up to be in an unattainable circumstance as well. So it's kind of the all or nothing on the 4th of July. Either we have the 4th of July or we don't have the 4th of July.
I completely agree, but so, and we shouldn't, and I guess what I'm bringing up just, I mean, from my point of view, I've now had my second shot because I'm over 65. And so, you know, my age group, which was the one that, you know, we're now all looking towards, well, what does this mean? You know, and so, and I suspect the discussion, the 4th of July is going to start coming up more and more and more.
Sure.
But Jennifer, I agree 100% with you. The attitude is that, you know, that we're going to monitor everything. But I agree with you. It needs to be all or nothing.
Yeah.
I mean, because for us attempting to do something different would be a disaster. And so it really just comes down to monitoring everything as it occurs. When would you have to make that decision to go or no go?
So we discussed that. So the drop dead date is about 2 weeks from now.
Wow.
Yeah. Yeah. And so then again, we circle back with public health to be able to say, will we be in any different position to make a decision 2 weeks from now? The answer is no. We won't. So again, it's dealing with what we know.
It's so what does your gut tell you that we'll in 2 weeks we'll say yes?
Yeah.
Okay. Well, and that's what I assumed, and I guess I just wanted to start getting that discussion out there with council. So Well, okay.
And then,
well,
and then again, it's for people to decide whether that, so again, all of staff was like, it doesn't matter to me personally, who would be vaccinated or not. I am not comfortable not wearing a mask in a crowd. I'm just not there. So when I go, I will go and I'll have a great time, and I'm going to go and have a great time and I have my mask on.
Okay.
Because again, we're just,
Okay. Well,
I think that's all part of the realistic piece of the conversation.
yeah, no, I agree, Jennifer, completely. And I guess that's part of why I was bringing it up, is because it's going to start percolating out. I mean, I got the feeling that there was a discussion in the community that may come from your discussions that the July 4th was a go. And I just wanted, I mean, so I just wanted to get that discussion out there because it's out there anyway.
Yeah. Yeah.
So,
Yeah. I don't think we're quite, I mean, I'm not totally comfortable yet having this conversation in a public setting to say, yeah, we're going to.
No, I hear you, but I wanted to go ahead. I'm hearing, that's what I'm hearing out of the public. And so that it's likely that we would have the 4th of July. And so we need, and like you said in the emails today, and we need to, I mean, next Tuesday's a huge meeting anyway. Guyleen and I were talking about it earlier. So, but we're going to need to set aside a little bit of time to talk about these issues next Tuesday.
Agreed.
Yep.
Okay. I mean, so you covered what I wanted. I mean, it's out there and it's time to.
And I think Jen hit it perfectly. I mean, obviously, if you go with the public health recommendations, our recommendations are trying to keep community transmission as low as possible. But then you have the reality, and that's happening in Denver. It's happening in other counties as well, that, and Denver's even talking about it. What do they do with Coors Field, and what do they do with some of these large event places? So it's not just Brimfield that's having to deal with this reality. It's got to a place as us as a community and the policymakers with low hospitalizations, in our recommendation of this, at least keep transmission manageable. At what level keep doing that at the expense of keeping the public on board with what we're trying to do.
Yeah. Yes.
I mean, and all of us were talking about, the thought of embracing or shaking hands, or, I mean, I don't know at what point in the future that comes, right? But I mean, again, it's for those of us that have actually engaged and seen the repercussions of right when, I mean, one of our staff members just got COVID. And so everybody's thinking we're on the tail end and everything's great. And, we're back to the whole, and all of staff is like, no, nope. Right. Let's social distance. Let's keep the meeting
I agree,
social
yeah.
distance.
Yeah, no, I mean, I agree completely with what you're saying, but at the end of the day, the announcements, I mean, just what Jason said today, that by May 21st, that 80% of the population will be vaccinated, does change the dynamic. And I,
Absolutely.
Jennifer, I agree 100% with you. It's all or nothing.
Yep.
So
yep.
That
Good.
answers my, yeah.
So I just kind of had a quick follow-up on the vaccinations, and are you requiring staff to be vaccinated?
You want to take that, Jen?
That is such a good question. And so outside of legal's perspective, my thought was, well, heck yeah, if you want to come in the building, you're going to be vaccinated. But apparently legally you can't do that.
Oh.
You can say
There's Pat.
we highly recommend. Oh, there's Pat. There you go. We can highly recommend that you do that, but we can't make you as part of your employment. Pat, did I get that right?
It's kind of nuanced because there are some, we have police officers, we have nursing staff. It's not a one size fit all answer, but my recommendation has been that, we do not require it.
I totally get that, because I know that, CSU is requiring their students to be vaccinated to return to in-person learning, but they're not requiring it of their staff and faculty. So I don't get that logic at all. But just like the House, you know, they have an indoor mask mandate, but some members of the assembly refuse to wear masks. So we have to at least have some type of parameter in that if we return to the chambers for me to feel safe. And I think it has to be mutually agreed upon. What comfort level we have if people are refusing to be vaccinated and wear a mask. Can we do that?
So I'm gonna say this even with Pat on the line. I am not opposed to a little public shaming. Seriously, right? I mean, we have endured here, and so to open the doors again without, so we plan on keeping the dais, the new dais that you all have seen, so that you're not all up there together. So again, kind of those accoutrements, but what we do have to remember is what type of additional accommodations in the chambers, right? Like a full plexiglass, because my guess is that staff will be mindful, especially staff that participates with council, right? Will be much more conscientious. Not that I don't want to say that than we otherwise would be, because consistently, but the public that you all have coming in may not. And I'll just leave it there.
I didn't know there was public. I'm just kidding.
Well, and so again, Guyleen, so where we had that first row of chairs that we took those chairs out in order to build that dais, council may want to advise, which I would recommend, quite frankly, that we do a big plexiglass, because if we do have public that are coming in that do not want to, wear a mask. And once that mandate is off, we can't make them. Those are tight quarters in that room.
So have we improved the ventilation in that room? I mean, on my
Ventilation
back to business deal, ventilation's still one of the bigger things you can do.
That ventilation in that room's always been really good.
Okay.
That hasn't been one of the, I'm just talking about, I mean, it's not even a stone's throw from those first rows.
No, I mean, I was just thinking of other mitigating things.
Yeah. Well, we're pretty good with ventilation. It's more the proximity.
Well, I think, if we could allow the public to come in to speak and maybe someone have to wait outside or whatever and put the plexiglass, that's better than not letting them speak. Because I think we need to start.
I'm going to go ahead and do that plexiglass then. Yeah.
What the hell?
Yeah. Okay. Yeah. You know what? I mean, you can't win for losing. So no matter what decision we make, it's going to be the wrong one.
Well,
but
I mean, our council's been pretty cautious
for us to do that.
So.
And continue to wear our masks.
Yeah.
Right, Jason?
I want to talk about,
yeah. Councilmember Anderson.
Just after this discussion, I just have one more question, like coming from my own perspective of someone who has 5 children, 4 of them still at home. And I get my 2 Moderna shots and I'm fully vaccinated past my 2 weeks. I feel confident. I feel confident to go out there and sit up at the dais and say, yes, I've been vaccinated. But could I become contagious if I became close to somebody and bring that home to my children? I think that is is going to continue to be the sticking point for me. I don't want to bring something home to my children who are not yet old enough to be vaccinated. Everything goes through the 4th of July celebration, all these things we got to keep. I'll always be keeping an eye on those kids because it's going to hit home for me. But thank you.
No, that's a good point. And I'll actually get the actual data on what it says as far as, again, I talked about those asymptomatic with the vaccine and the effectiveness versus symptomatic. And then if you were exposed to somebody, my understanding is and it's individual, but the level of antibodies that you've built up would give you a place that you would probably most likely be protected. But again, we don't know what the asymptomatic, say you're sitting next to somebody and they're asymptomatic. That's what the CDC is still trying to figure out, is what's that level of potential risk. And it just hasn't been defined yet. Mayor Quinn?
Yeah, and so, I mean, going back, and Lori acknowledged it, that Helene's been real helpful in getting appointments. I'm assuming right now, and if I read the email last week, it was for family as well. So once, I like Lori, I have a 15 and a 19-year-old that are now become available. I'm assuming that, and let's just say, but if the diocese is going to be May 8th or June 8th, that take back 2 weeks from that, we should be able to get those kids. We should be able to get their shots by May sometime.
Yes, but then the family members would be 16 plus until they start to approve the vaccine for children. So right now we're just
Lori's kids are younger than
16 and over.
And I have a daughter turning 16 on April 19th.
Perfect.
So I'm sorry, Lori, I forgot about that. My mind's not gone to the Maddie can get it because she's 16 in 2 weeks.
And I think the only last thing I'll say before we close up is all of this we need to plan based on our current information and data, but the one variant that everybody's concerned about is the one that the vaccine's less effective against, and it's the Brazil variant. So if we start to see variants take hold and become more predominant in Colorado and in Broomfield, I think it has to be another conversation at that point in time. And I'm just putting that out for the public just to create realistic expectations, because we don't want to set ourselves back after we've made it this far for a year with something like that. And that's the only one caveat I would throw out.
Yeah, so you sound like an attorney now.
I've learned. I appreciate the robust discussion, and as I said, there's a lot of moving parts, but we appreciate your feedback and look forward to providing the update to council on the 6th.
And we all appreciate staff's efforts, to say the least. So
thanks.
So
have a great afternoon, everybody.
You guys too. Thank you so much.
Bye.
Bye.